Summer heat comes with health concerns, and it doesn't even need to be sweltering hot before your body reacts. Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. From the danger of hot cars to the medications that put us at higher risk of heat-related illness. Today, we are focused on giving you valuable information to keep you and your loved ones safe this summer. We have a great lineup of experts with us this morning, ready to share the biggest heat impacts in each of their specialties. Everything from cardiology to pharmacology to sleep medicine. But before we dive into our discussion, we want to highlight one of the biggest dangers, and that is hot cars, which can act like ovens when they sit in the sun all day. So please, of course, do not try this at home. But our own Jill Chadwick met up with emergency medicine physician Janak Patel to experience that heat.
The outdoor temperature is about what today?
It's 83 degrees right now. It's overcast. There's a little bit of a breeze. Feels not bad compared to the last couple of days we've had.
Which it's almost the same as my pulse.
It is. That's right.
Yeah.
We just took Jill's vital signs, and her heart rate's about 83 right now, and that's going to be our baseline. We'll see what it is when you come out of the car.
Okay, let's get in the car and see how fast this gets hot. I will tell you that right now it feels like you just want to roll down the windows or just put the air conditioner on full blast. But I feel pretty good, but I can tell by the thermometer that the temperature is really going up really pretty fast.
Yeah, and you're exactly right. You know, even though it's an overcast kind of day, with this being a vehicle, it's going to hold on to that heat. The asphalt's going to radiate heat. So even though it's 83 degrees, it's going to feel a lot hotter in there. You can already start to see that Jill is experiencing some stages of heat illness. You can see she's a little bit more flushed. Those are going to be the blood capillaries expanding. When you're trying to get rid of that heat, it's important that all of your blood circulates to the periphery and you can cool down that way. You may also notice, Jill, that your ring may be harder to get off as your hands are starting to swell a little bit. These are all the beginning signs that you may need to get into a cool environment and drink some water. You really should listen to your body, Jill. And so if you're having any symptoms such as dizziness, nausea, vomiting, headache, and you've been out in the sun, that's your body giving you a warning sign that you really need to get to a cool environment and cool off right away. So go to a place that's air conditioned, that's under the shade, drink some water, and rest until you start to feel better.
I am definitely sweating. Yeah, this is like sitting in a sauna. A really steamy sauna is how it feels.
Yeah, we've exceeded the max capacity of the thermometer we brought with us. You know, I'm sure inside it's exceeding 140 degrees. The sun is now out. This vehicle doesn't have a lot of tint on it. It's black in color. We're on an asphalt, and so I'm sure you're really feeling it. So let's go ahead and take your vital signs again. Okay, now.
Whoa.
Yeah. Jill, how do you feel?
A little lightheaded, honestly.
Yeah.
Yeah.
Yeah. So I would say your heart rate is probably about 130 to 140 right now, which is almost double what it was when we started this experiment.
Yeah, and I do have low blood pressure, so sometimes when I get up, I feel dizzy, but this is a different kind of dizzy.
Absolutely, and if you need to sit down again, please feel free. But this is exactly what can happen, and so you're probably experiencing some early stages of heat exhaustion. We're talking about heat illness earlier, and so that middle stage is that heat exhaustion. This is your body giving you warning signs that you really should get inside and cool down. And if you don't listen to those warning signs, it really can progress in some serious and life-threatening conditions, such as heat stroke.
Wow, thanks.
You're very welcome. Stay safe.
I feel good. No, don't go anywhere.
Again, do not do that yourself. Let Jill leave that to the experts for sure. So we saw Dr. Patel using a cell phone to communicate there with Jill while she was in the car. And we have Dr. Patel with us here this morning. Dr. Patel, Jill was sweating, her skin was hot, she was flushed, she felt dizzy. Once someone though gets into a cooler environment, how quickly does their body recover?
That's an excellent question. It really varies on their age and how healthy they may be. You could expect that within a few minutes you should start to feel better, but really it'll take about half an hour before your vital signs start to return back to normal.
So if there's one word we want people to remember today, of course, it's hydration. We can never say that enough. But why is hydrating, especially with cold water, so important? What's that doing to the body?
Absolutely. Evaporation is one of the best mechanisms your body has to cool down. And you can lose a ton of water through that process. So it's important that you continue to hydrate and replete that water that you've been losing so you can continue to keep your body cool.
So whether or not it's a hot car, what can a bystander do to help if they see someone who appears to be having some type of heat-related emergency?
Absolutely. Great question. The best thing anyone can do is get that person out of that environment. So if it's outside, get them into the shade or an air-conditioned area. Get them out of the heat exposure that they're having currently. Stay with them and evaluate them. Everyone's not always comfortable doing this, but see how they're doing. And if they're confused or altered, that's somebody that you need to call 911 for right away. That could be a sign of a heat stroke. If they're just having dizziness and they're a little nauseous, you can wait, get them some water, make sure they're feeling better. If they're not improving, at that point, it would be a good idea to go ahead and call 911 as well.
Dr. Patel, are there any trends that you are noticing on who is coming into the emergency department more often with heat-related problems?
Sure. Certainly everyone is at risk, but our most at-risk population often include our elderly patients, and that's really part of it is the social determinants of health. Elderly patients are often in older homes. Their air conditioning units may be old as well and are not able to keep up with the demands of 99-degree days. And so it's often hotter in those homes as is. And if their AC stops working, they can be in trouble pretty quickly. And so those are often the patients that we see more often during these extreme heat waves. That's not to say everyone's not at risk. Everyone certainly is at risk, but those are often the patients we see more often.
Dr. Patel, thank you. Let's move on to our pediatrician, Dr. Stephen Lauer. Good morning. How are you?
Good morning. Doing great. Thank you.
So kids, we know they're especially vulnerable to heat and they're out in it quite often. We want them to be outside as much as possible. But what kind of warning signs should parents be looking for to recognize if their child is truly overheated?
Well, as Dr. Patel mentioned, the first thing is our first response is to sweat. And so, as your kids start sweating more outside, you just want to be aware that that's happening. It's a sign that they're warm. As it gets worse, they might get a little more irritable. They might complain of muscle cramps or say that they have a headache. Again, signs that things are progressing along in that heat exhaustion pathway and time to get them in. When it gets really dangerous is when we actually overheat and start losing that ability to sweat, in which case their skin often gets red and flushed. They look dry on their skin instead of sweating. And at that point, they're often going to be clearly confused, altered mental status, and that's when it crosses the line into really dangerous. You've got to get them back inside, do all those things that Dr. Patel talked about.
Dr. Lauer, I know when I get my kids up in the morning, I'm kind of thinking about those hot summer days, and I start them on water. I say, start getting hydrated early, guys, so that they can kind of get ahead of it, because I know they're going to forget later. So what other precautions should parents be taking to keep their kids safe from the heat? How can they kind of prep them?
Well, staying hydrated, as you said, you can't say that enough. Making sure they're drinking water through the day is truly the most important thing. Think about the way the day is going to be. We know, noon to 4 in Kansas City is just going to be hot. And so are there activities that can be planned, the outside activities, not in those peak times. So trying to plan around that if at all possible. Protective, some light protective clothing, hats, so they're not in the direct sunlight. And then the environment they're going to be in outside. Are they going to be able to get to some shade? Can they get in and out of that and so get some relief from that direct sunlight? And then parents just need to be watching them. I mean, as you said, we want them outside. It's important to be active and keep doing things. But what's that environment that's going to let them get into those cooler areas, stay hydrated throughout the day? The big issue is that children, while adults, especially the elderly, can get behind quickly, children can tip over much faster than their parents were. So I was just trying to remind people, if you're outside with your kids and you're hot, your kids are really hot, and you need to start getting them think about that safer environment.
Dr. Lauer, let's talk about hot cars. And we see and hear these stories on the news where tragically a parent simply forgets their kids, leaves them inside a hot car. No one wants to be that story. So what tips do you have for just preventing those hot car tragedies?
Well, the video at the beginning was excellent on this. It almost became the question, would you leave your kid in an oven? And I'm pretty sure the answer is no. So that there just isn't a safe time limit to do this in. That video just showed the temperatures go up so fast, and that I'm just running in for a minute. I'm just going to do one thing and I'll be right back. That's where most of these stories come from. So the only real advice is just don't do it. You know, take your child with you. If you have to get out of the car and do something, just take them with you. There's no safe amount of time to leave a child in a car in the middle of the summer in Kansas City.
Great warning. Dr. Lauer, always good to have you. I know you got to go, so thank you so much.
Okay, thank you.
All right, let's turn. Let's go from the young to the old. And we've got Dr. Jessica Callender-Rich, a geriatric medicine specialist. How are you?
Good, thanks.
Good to see you. So what factors make older adults more susceptible to heat-related illness?
You know, I think that some of the other people on have really touched on some of this, right? Like there are lots of medical conditions, people are taking lots of medicines, but in addition to that, older adults tend to have a decreased thirst mechanism, so they don't really know that they're thirsty. And so we might tell people to hydrate, and if you get thirsty that it's too late, but even remembering to drink and even having that sort of trigger, baseline trigger that many of us have to drink is really lacking for a lot of older adults.
The older you get, do you dehydrate quicker?
So it's not necessarily that you dehydrate quicker. Your skin is thinner.
Okay.
And so you may not retain that moisture as long or as well, but it's not, it's most often going to be worsened by a lot of the different kinds of medications that you might be taking for other conditions.
So how can caregivers ensure that their elderly loved ones stay safe and comfortable in these high heat temperatures?
Yeah, so you know, hydration, obviously, the key word for today is keep drinking water, but also electrolytes, right? We don't want to drink a ton of water and nothing else. So eating and drinking, and maybe a little bit of Gatorade thrown in there. And then, you know, really focusing on ensuring that you're taking breaks. So somebody called me recently, they were taking their 85-year-old family member to Silver Dollar City. Great. But, right, what should they do? So after they hang out outside for a little while, they need to go inside for a little while. And really just being very aware of the limitations that you may not be feeling, but that your loved ones may be feeling.
That's exactly what I was going to say. You know, just because you're feeling one way, your kids and your older adults may be different. So what are some other do's and don'ts as far as, you know, any common mistakes that are made, anything we should avoid?
Yeah, so I will say that the heat sometimes will lead people who normally have kind of more mild memory problems. It can really exacerbate any medical condition, including things like memory. And so reminding people to do things they may not need reminders for is really important. I'm going to say hydration again, just because I think that we just should keep saying it. And, you know, other things are, I love how when Jill got out of the car, she stood up really slowly. Right, so that dizziness piece can be really exacerbated in that heat.
That makes sense.
Yeah.
You could send your questions in right now as we're speaking, because you may have some for all of our experts today. You can use the chat on YouTube or Facebook. You can email the Medical News Network. Information is right there on your screen. For medications and the heat, there are two problems that we need to talk about. One's pretty simple, one not so simple. The simple problem is storage. Very important when you're packaging up and your bags for the summer road trips and all that sorts of things. So I want to talk to Ashley Christian. She is a pharmacy administration and leadership resident here at the health system. Ashley, good to see you.
Thanks for having me.
Good. So what happens when drugs are left in a heated car?
Yeah, so leaving drugs or medications at high temperatures for a long period of time can cause them to break down or degrade, and that can lead to a decrease in their potency or their effectiveness. We can see this through some physical changes with some medications. That could be a change in color, a change in texture, consistency, maybe even smell. But with some medications, we may not have those signs, so it is going to be very important to make sure that we're always storing our medications appropriately, Usually that's going to be in a cool, dry place, or is otherwise instructed by your pharmacy or on your prescription bottle.
I was just thinking how often we go, oh my gosh, I don't want to leave my phone in the heat, or oh my gosh, my phone might be heating up. That's so dangerous and such a big deal, and we forget about everything else. The not so simple problem that we want to talk about is when our medications make us more susceptible to those heat-related illnesses. So maybe they dehydrate us much more quicker, or they make our heart work harder. What are some of the common meds that don't mix well with heat?
Yeah, so we kind of talked about storage, but as you mentioned, there's some that don't mix well for us and can make us more susceptible to the symptoms of heat exhaustion. Some of those are going to be our cardiovascular meds, such as our diuretics, beta blockers, and others that we use to treat high blood pressure and heart failure, but also some of our medications we may use to treat mental health, or even some over-the-counter medications. Aside from the symptoms of heat exhaustion, however, some can even make us more exposed to sun damage and sunburn, such as antibiotics, some topical creams, some older oral diabetic medications, and then again, some other over-the-counters.
So what advice do you have for patients taking these meds to help them stay safe?
Again, I'm going to reiterate, hydrate, wear your sunscreen, try not to be outside during those peak temperatures and hottest times of the day. And if you do have any questions about how your medications may affect you in the heat, definitely talk to your local pharmacist or healthcare provider.
All right, let's bring in our cardiologist, Dr. Shannon H Thompson. Dr. H Thompson, what do you say to patients who are out in the heat, it's summertime, and who might be on some of these medications that could affect their heart?
Well, you have to remember that they're on those medications for a reason. I think you have to be careful that some people want to hold their medicines or maybe don't take them at the same time getting the answers. You have to be careful. You're vulnerable to that because you have those conditions to begin with, and the medicines may exacerbate that or make you less prone to, again, the symptoms that come with it until it's pretty advanced or more severe of an event. One thing we ignore is that people with these conditions and on these medications, they have a delayed recovery. Like you talk about, okay, how long does it take somebody to feel better if they've reached a level of heat exhaustion or some level of heat related illness, and the answer is that's delayed and more prolonged in people who have these conditions. We talk about hydration and the fact that hydration is not just water. I remind my patients all the time that you can overdrink water, and you have to be careful that there's a balance to what you're putting into your body. But exposures are a really big part of it. And when you talk about breaks going slow, adaptability, even when you go from a hot condition and now you rush somebody or step into your perfectly air-conditioned home or building, that transition period is a very vulnerable period for people to get very lightheaded, pass out, get nauseated, things like that. So you have to watch the transition too when you go from a really hot region into a cooler region and vice versa. Simple things like you go from a air-conditioned room into your hot, humid shower. So sometimes you want to start with a more temperate water when you're taking a shower, especially if you're vulnerable to those symptoms to begin with, and then maybe heat it up a little bit when you get to a more comfortable level in your shower, and then actually back it off before you get out. Because again, these are things that I get consulted about and see patients for year-round, but they're brought out more during this time of year and when we have the more extreme temperatures, and then the transition when you're in the cooler places, that matters too.
So what kind of strain does heat put on the actual cardiovascular system overall? And how is that strain different for healthy people versus maybe someone who has a existing heart issue?
How's that? It's just, again, like you talk about compensation, like the geriatric explanation of the thinner skin, and just the reactivity of your muscle, the reactivity of a muscle, a blood vessel to react, to dilate so you can sweat, and then to contract back down so that you can retain that hydration or put it in the places you need it. That's very delayed and hindered to begin with, and then some of the medications make you more vulnerable to, again, delaying that or limiting that. And so the transition period is really important. Planning ahead is really important. And a lot of people say, oh, I want to be tough. I'm not a wimp. I'm going to push through and get it done. And actually, it's not necessarily doing the activity that always gets people in trouble and feeling the symptoms then. It's a lot of times the after effect or a day or two later, and people are still feeling poor and not recovering. And so you have to pay attention to, it's not just about getting through the activity. If you're not feeling right, back off. It's worth living to fight another day. And it's not worth dealing with the issue. You can go back and finish that yard work. You can go back and be working in a garage or things like that the following day or at a different time. You don't have to do it all at the same time.
And you've mentioned it, you talked a little bit about the symptoms, but if there's one or two top symptoms that heart patients should really be on the lookout for during this hot weather, what would they be?
It's no different than anybody else. You do become lightheaded, you do become tired, you do have less cognitive awareness or acuity. I would say it's very much that. A lot of people get lightheaded and short of breath and just feel profoundly weak. Is what I see when I get called. And yes, we can do tests where the blood enzymes for the heart become elevated, and you can see changes in blood pressure, heart rates, symptoms of palpitations. Yeah, those are appropriate responses and expected responses when you've had too much heat exposure and your body's not able to adapt further.
Well, as we promised, we mentioned sleep and heat, but our sleep medicine specialist had to leave. But to summarize what she was going to share, really a hot environment does hurt your sleep hygiene. Doctors say to keep your bedroom cool, really to get the best night's sleep possible. Let's get to some questions from our viewers this morning. And Jill wants to know, what is like that top temperature, Dr. Callender-Rich, for seniors that we really should be, if we're out with our senior, what temperature should we be looking at? As a cutoff?
Sure. I mean, there's not a really clear cutoff, but I'll highlight that when we did that car experiment, it was like 83 degrees outside, right, or something like that. And so, any temperature can be a problem, certainly as we're climbing into the 80s and definitely higher. That's really a time that we need to just really have that awareness of the possibility of a problem.
Yeah, I was surprised at that 83-degree temperature. We think getting in those upper 90s is danger zone, but it really starts even in the lower 80s. Dr. Patel, are those electrolyte drinks like Gatorade, how do they compare to water? I mean, is it okay to mix them in? Do they dehydrate us more? We know they have sugar in them, so how do we know what to drink?
That's a good question. I would recommend everyone talk to their own individual physician because it'll depend on what medical history you have on what's really going to be recommended. Water is great, but you really do lose a lot of electrolytes in addition when you're sweating, and so some of those side effects may be cramping, and so you may need some sodium and potassium. There's no perfect ratio out there, especially if you are having cramping. Though electrolyte drinks are great. If you've got some reason why you want to double check on that, for example, if you have diabetes and the sugar in those drinks may not be great for you, in that scenario, I would talk to your physician. So hydrate with water, and then you can mix in Gatorade kind of as needed.
Juan also has a question. Are there any international protocols to prevent heat stroke?
There's none that I'm aware of. We certainly have a lot of guidelines in terms of treating heat stroke. And so if patients come to the emergency room, our team is very well versed in how to take care of that. In terms of prevention, I think what everyone said on this panel is fantastic advice. Really be aware of the symptoms that you're experiencing, get into a cool environment early, avoid those peak hours, and try and delay activities to early morning or late in the evening when it's cooler, if there's something that you absolutely have to get done.
And Dr. Patel, Amy just wants to know, so does that mean that heat stroke is always preceded by heat exhaustion? Kind of help us understand the difference between the two.
Yeah, it's an excellent question. So really, we think about heat illness as a spectrum. In the beginning stages, you may have very simple symptoms that we've all probably experienced, such as heat edema. Your hands start to swell a little bit. That can progress to heat exhaustion, which has a myriad of symptoms, such as nausea, headache, vomiting, feeling faint or dizzy, lightheadedness. All of those symptoms are of heat exhaustion. And those are really warning signs your body's telling you, you need to do something now, get into a cool environment. Otherwise, this is going to progress. And that progression of those symptoms results in heat stroke. Heat stroke is when you have a temperature above 104 degrees Fahrenheit, and then you should also be confused or altered. That's a very life-threatening condition, and we hope that we never see patients reach that point. And so when you're at that heat exhaustion phase, that is really your opportunity to intervene and prevent yourself or someone else from getting into those dangerous heat stroke conditions.
Dr. Patel, from your perspective, what's the biggest takeaway from our chat today?
Yeah, I think the biggest takeaway will be that if you have elderly patients, neighbors, family members, please do go and check on them. They are at risk, they're vulnerable. And sometimes it's too late. Just having a day of those really high temperatures with no air conditioning can have a detrimental impact on their health. And so just make sure you know who those people are in your neighborhood. Check up on them. They'll really appreciate it.
As far as our heart health goes, Dr. H Thompson, what's the biggest takeaway?
Yeah, so the point is not to push through. I talk to a lot of patients who want to push through their symptoms, get that yard finished, get finishing their activity they're up to, and it's like, you know what, when you start feeling bad, it's not because you're not strong or tough enough, it's because your body's having trouble adapting, and you will pay the price at some point. So it's worth backing off, taking your time, and not getting yourself in trouble. It's just not worth it. So it's okay to back off. It's okay to let somebody know you're not feeling well and that you need to recover, and then make sure you get better, and letting people know that when you're older, when you're on medications for various conditions, that can take longer.
Yeah, listen to your body. Ashley, what's the big takeaway?
I would go back to making sure we're storing our medications appropriately, not leaving them out in the heat or in our car so that they're effective.
All right, treat them the way we do our cell phones.
Exactly.
Right? Just as
only
important.
we could get the alerts.
Exactly. Okay, Dr. Calder-Rich, what's the big takeaway?
I feel like I should just circle it up with hydration.
Yeah, go for it.
Like the hydration is the key here, whether it's water or electrolytes or whatever it is, right? I love what everyone's saying, right? We need to check on our neighbors, we need to check on ourselves, and we need to make sure that we're doing the things that we know are the things to keep us safe, right? So that's hydration, and that's taking breaks, going inside and listening to our bodies.
I love what you said. Take care of yourselves and take care of each other. Be on the lookout. Good to see you. Great. Thank you to all of our guests. Great panel, great experts, great information. Thanks to our viewers today. On our next episode on Monday, we'll see you then, but also on Monday, join us for a 10:30 a.m. special presentation to learn what's next for Liberty Hospital and the University of Kansas Health System. Everyone, have a great weekend.
Coming up Monday on the Morning Medical Update, Courtney Walker's GI infection kept coming back. After 5 hospital stays, she needed a new approach to stop the cycle. I'm Alexis Del Cid. On the next Morning Medical Update, fecal transplants, when someone else's waste becomes the treatment. That's Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.